Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blaiklock, and joining me this episode for our topic of Hardin Memorial Health Foundation is Senator Joe Prather, Dr. William Nash, and Tracee Troutt. Thank you for being here with us for this episode.
Glad to be with you, Karen.
Thank you.
Well, Senator Prather, as our chairperson of the Hardin Memorial Health Foundation, tell us a little bit about the role of Hardin Memorial Health Foundation and what it plans to accomplish.
Well, first off, Hardin Memorial Health Foundation is a 501c3 corporation, which in IRS parlance means that any donations that are made to the foundation are tax deductible. We stress that we are there to be helpful to Hardin Memorial Hospital, to be a difference maker. We think that on many breakthrough projects, which is where we mainly concern ourselves, that the hospital might have going, that we're able to help to fund some of the more advanced, whether it be technology, equipment, whatever might be, that allows it to be all it can be. I like to say that if the hospital makes the cake, that we provide the icing. So that's kind of where we are. We not only look to the present, but it's our vision to be able to create a strong healthcare system for this 10-county area and over 400,000 people that we serve, so that not only can we have more advanced health care locally at home presently, but that our children and our grandchildren and generations to come can enjoy the fruits of our efforts. So there's nothing more important than a strong healthcare system as far as the quality of life in the community. There's a strong economic impact. We are just all about making Hardin Memorial all it can be, and we're excited about the journey.
Really taking care of its people, and I think when you hit on it when you said community, and we really are a regional hospital with the 10 counties. I think people forget, we are reaching out and branching out, correct?
Well, and we've reached out on the foundation board, and I think we'll talk more about that later, but we've reached out to some top flight people from a multi-county area, and so we're excited about the people who are involved, the people who are stepping up in order to be a part of what, who knows what the future brings. We're rising to new heights as we speak, and we're ready for what comes.
Sounds great. Well, Dr. Nash, you're the secretary of the foundation, correct? So in your role, we have many investments, I think, that the foundation has already made. And the hospital's first investment, I believe, was the neonatal level 2 nursery. Tell us a little bit about what's going on with the nursery.
Okay, well, thank you very much for having me here this morning, Karen. But, the neonatal ICU really reflects the future of Hardin Memorial Hospital, and that's one of the reasons our foundation chose it as a first project to champion, because it reflects all the goals of Hardin Memorial Hospital's strategic plan, which is number 1, to recruit new physician specialists, number 2, to implement new healthcare services, and number 3, to improve and renovate our facility. Hardin Memorial Hospital is the 9th busiest obstetrical care hospital in the state. We deliver, I believe, approximately 1,700 babies last year, and actually for the 2 years before that. And regrettably, when you have that volume of babies, you're also going to have some babies that are either premature or have some medical or physical issues that need the care of a specialist or a neonatologist. Well, in the past, we have had to send those babies to Louisville and their families to Louisville. But today, one of our projects, the NICU, is now going to be available, and those children and those babies and families are going to be able to stay right here because Hardin Memorial Hospital recruited 2 neonatologists from a renowned group of neonatologists in Louisville, and they are going to be here at our hospital 24 hours a day, 7 days a week, providing the same continuous great specialty care that they were getting there. The other thing is that the foundation stepped forward with the help of the Crusade for the Children, as well as the help of the pediatricians on staff, and as well as help from our own members of the foundation to fund some equipment such as the LED phototherapy and the NICU camera system and renovations to the facility and the waiting room to allow us to start providing that care right now. And if not the hospital and the foundation working together, if that had not happened, the children would still be having to go to Louisville at this time. But fortunately now we're going to be able to start those services right here. And I think that it just is another example of us funding some breakthrough projects that help keep Hardin Memorial strong and help keep it to be a center of excellence and to continue to build for the future.
Absolutely, and I had used the word nursery. It's really a neonatal intensive care unit.
Right.
And I think this is, we're progressing, with our health care here in our community and really providing this service.
Right, when you build new services and you bring new specialists on board, it just makes not only the level of care, but it makes the level of the physicians much better, and everybody benefits from that. So it's a way that we kind of keep growing and keep prospering and keep, giving back to the community.
We've been talking about this progress, so tell us a little bit about why a healthcare system really needs a foundation. Senator Prather.
Well, first off, as we talk about why we need a foundation, I think we need to make one point that I think is vitally important, and that is that Hardin Memorial Hospital is a health, or Hardin Memorial Health is a healthcare system that where every taxpayer in Hardin County really owns an equity position in Hardin Memorial Health. And what a privilege to be able to claim that ownership and feel the pride that goes with it when you really know that no tax dollars go toward building that asset. And that's exactly what happens here. Hardin Memorial Health is not only self-sustaining, but it creates a profit, and lately has been really excelling in doing that. So we as Hardin Countyans have always been proud, but I think there's a misconception among some people that our tax dollars go toward funding the hospital, when that is far from being correct. We are self-sustaining. We're a big asset. Whatever the value of Hardin Memorial Health over this 10-county area, and all the facilities and all of the value that the people who make it work bring, whatever that is, it's a huge asset to Hardin County without costing us one dime of tax dollars. So there are a lot of reasons in addition that for which the foundation needs to exist, and Dr. Nash, capital needs is one of them. I might turn to you to talk about some of those. You're very knowledgeable about those.
Well, we've just, when you're talking about capital expenditures, you're talking about growing the hospital and becoming the kind of facility that we want to become to remain a center of excellence. One example would be the North Tower project, where we recently added 56 private rooms. We basically have a lot of semi-private rooms, but that's one of the transformations that we want to do. But when you do that, it costs a tremendous amount of money, and you don't begin to recoup that money till later on. Now, one of the other projects that you've probably recently seen started in the paper is the Emergency Department Expansion Project, which is going to be a wonderful project. I think we are the third or fourth busiest emergency room in the state, but yet our bed space is way below what you would find at other hospitals comparable in the Louisville area and that. But that's going to take, I've heard, in excess of 15, maybe to $17 million. What that does is, although our financial performance has looked very encouraging, and we welcome that, we know that in the future it's going to go back down. It's never straight up. It's an up and down thing. So when you have that, you know, we're hoping to team as a foundation to, again, like we did with the NICU, to work on some special projects that just are not affordable within the budget, to lower the impact of some of the decline in revenue, which we know will happen in the years. And that's, you know, one of the projects that we really want to work with.
Right. To provide quality care, you actually need equipment. The Da Vinci, is that
right,
correct?
That's another one. Yeah, and I think that's $1 to $2 million. But if you want to stay at the forefront of surgical care and medical care and be able to offer what's being offered in our Louisville areas and other areas, we have to do those things. And you know, that's kind of brings me to another point, not only just the capital expenditure, but I believe we're the only hospital of this size in the area that does not have a foundation. Every other hospital has realized its importance. We had realized it. Unfortunately, you know, we kind of let it go for a while, but we've revived it now. And you know, the rhetorical question is, how do you expect to compete with these other hospitals if you don't have a foundation? We've got to get right up with them if we expect to continue to do. They know we have to do this to have good quality health care, and we need to do it too. And I'm glad to do it, and it will just pay great dividends for the community. I really believe that.
And I think, you know, it comes back to that quality of care really helps the outcomes with the patients, you know, care, their quality of life in the long run. So that's really what this is all about, and our sense of community. Which brings me back to Senator Prather with your longtime connections to Hardin Memorial Health. Tell us a little bit about some of those connections.
Of course, I was a child growing up in Elizabethtown. In fact, when I'm 11 years old, I think, when we moved from the farm. When I was about 12 or 13, the initiative started to try to build a hospital in Hardin County. I remember it well, everybody was involved in that, and we saw the excitement building. And I remember we, as I think it was probably 7th graders, we were asked to bring a quarter to school, and it was to buy a building block for the new hospital. So we all came in, and if somebody couldn't afford a quarter, somebody brought 50 cents. But in the end, we were sure that we had a quarter times the number of children that were in my class. We had a big celebration when we reached that. That sounds small, I guess, in some people's eyes, but in those days, it just indicated the excitement. I remember as the hospital was being constructed, and you know, it was a big event, and people kept track of that hospital construction. I'd ride my bicycle out there to watch it go up. And early on, I had a sports injury when I was, after the hospital opened for business. I remember the room rate was $15 a day. But you know, even in those days, I received wonderful care at Hardin Memorial Hospital. That has always been the trademark of the hospital. So we as foundation members, as we embrace Hardin Memorial Health, it started out as Hardin Memorial Hospital, but now reaching out to 10 counties, it's Hardin Memorial Health, and that excitement continues today in the eyes of most people. But we in the foundation we're not only about raising money, although we realize that that's a significant part of what we need to be doing, but we are about involving community leaders and difference makers in causing everyone else to join the excitement that we feel as we move forward. There's nothing more important to a community than quality health care. There's nothing more important to our economy than the ripple effect that the hospital as the third largest employer has. Just so many reasons to be excited about Hardin Memorial, and I couldn't be prouder to be involved.
Well, you're energizing me, because I feel that sense of pride and that sense of community, and I think that's really what shines through when you speak. You can see it and hear it in your voice. So that's wonderful, and that's really what it is all about. And health is so important to all of us. I mean, that really is, when you first say, what do you want? You want health, you want family, you want that sense of community and friends, and that's really what this is all about.
Well, I remember back in the early days, I think the community was able to attract one or two surgeons. We had two surgeons, Dr. Nash, and we had several family practitioners, and that was the extent of the medical staff that we had at Hardin Memorial. But we've seen that grow to where today, you know, we really are difference makers with all of the, you know, the success is assured in any organization by a blend of the old and the new, with new ideas and fresh ideas to go with the wise thoughts of those who have been around for a while. And that's what we have in our medical staff today. And so we are providing first-class care at a very affordable rate, and if we happen to make a profit, it comes right back into building a better system. What better answer could you seek?
Excellent. Well, Dr. Nash, with your background and longevity with the hospital and definite dedication that you have had to, tell us what it means to be serving on the Hardin Memorial Health Foundation.
Well, sure, I'd like to do that. You know, it's interesting. No, I want to kind of just comment on something that Senator Prather said that I think is so. He started out with, you know, the way the hospital in their schools, they did little contributions, 25 cents or 50 cents. But you know, a little means a lot. I remember a story my parents used to tell me about a grandfather walking with his grandson by a lake, and he says, you know, pick up that rock and throw it in the lake, and you'll see, and the lake will rise. And you know, the grandson throws the rock in the lake, and he says, Grandpa, I did it, but I don't see anything rise. And he says, no, but you saw the ripples. And that's what we're talking about here in the community. We all contribute a little, and if we do that, we're going to see some ripples, and some of those ripples are going to turn into waves. But anyway, getting back, you know, to your question, my wife and I and our family, we moved here in 1986 when I got off active duty with the 82nd Airborne Division, and we've lived here ever since. You know, Hardin Memorial Hospital, to me, has always provided a great hospital for me to treat my patients. It's also provided me a place where I could practice my specialty, and I always felt had excellent support and care. You know, the other thing is that Hardin Memorial also provided my wife and I the means to build our home and to raise our family in this superb region of Kentucky, and for that we'll always be grateful. But I think also serving on the foundation and working with this is a way for me to say thanks to Hardin Memorial and to say thanks to our community. When I say our community, I mean all the people of the 10 regions of which we serve. And I think finally, you know, and maybe just as important, is it gives me an opportunity to honor the legacy of the visionaries that helped found Hardin Memorial Hospital, and I think that's important. And you know, supporting a project, as Joe Prather says, of, you know, healthcare in this region, where you're providing an ability to continue to allow us citizens to obtain affordable, best in quality health care for them, for their children, for their grandchildren today and long into the future. What better project can you have than that? And I'm 100% committed to Hardin Memorial Hospital and 100% thankful for all they did.
Well, it truly is that sense of community, that connection, because we have so many individuals in the community that are either born, they have family members that work at the hospital. I am always amazed when I'm out and about in the community. The little children will say, "I was born there," or "Do you know my mother? Do you know?
Right.
Do you know my aunt? Do you know my grandma?"
My last
my
child
dad?"
was born there.
Yes,
I'm proud
so
to say.
it-
And now he's going to U of L Medical School, and hopefully he will come back here if he decides to, and
Right.
if he's lucky enough to practice here.
And that's that sense of community, that
Right.
true connection. Well, as we talk about that, Tracee, as our Chief Foundation Officer, tell us a little bit about who comprises the foundation with our community members.
Sure. Well, I think these two leaders are prime examples of the power of this board. I mean, you can see from the conversation today that these folks are really committed to this community. They're passionate about making HMH stronger. And as Joe mentioned, we have 23 board members from across the region. Our footprint in Central Kentucky is strong, and our patients come from all across Central Kentucky, and so we set out to recruit a board that represented them. And so, as we grow and develop, we hope to grow into those other counties as well, and to get even more leaders plugged into the board. The 23 leaders represent a lot of different occupations. We have housewives, we have physicians, we have community leaders, we have entrepreneurs, business owners from Nelson County, from LaRue County, from Hardin County as well. So I think they'll do a good job of really thinking about what the system needs into the future to stay strong. And they are committed to making a difference and to providing the things that will really give us an edge and make us the best system we can be.
That's a great cross-section and a description, I think, that truly shows that you've invested in looking at the leaders that are going to make some great decisions for our future of Hardin Memorial Health. Tell us, we've been talking about the Nicu, which is the Neonatal Intensive Care Unit, and with that investment, where do we plan to go and maybe future investments?
Well, the neonatal intensive care unit was a perfect first project for a lot of reasons. Dr. Nash mentioned the need, that we're the 9th largest or 9th busiest delivering hospital in Kentucky. So the success is already evident. The volumes in our birthplace are strong. We had our first baby a little over a week ago that we were really able to do everything with. We were able to keep him here. The neonatologist was able to administer the lung treatment that he needed. He was born at 34 weeks, and he is still here today in Hardin County. His parents, grandparents, and family can see him and be with him because he didn't have to be transported to Louisville. So we're already seeing the power of that project. What the foundation was able to do was make sure that the renovations and the equipment were the best they can be. I mean, we, as Dr. Nash mentioned, had the new neonatologist. We improved processes all across the hospital to be ready, and then the foundation was able to to complete the whole project and to make it perfect, so that little babies like this one could have everything they need to stay close to home. And they did that in 3 or 4 different ways. First and foremost, these leaders invested. The foundation board has all made contributions to the health system. The Hardin Memorial Health Auxiliary has invested. That's our group of volunteers. The leadership team has made donations to the foundation. I think Dr. Nash mentioned our pediatricians themselves invested in the NICU. And we had our first corporate donation last week. Senator Prather accepted a check on the foundation's behalf from your community bank. And Jim Rickard, who saw the value of the system and the foundation and invested. And then finally, a large chunk of what we've been able to do for the NICU came from, as Dr. Nash said, some grants. The Crusade for Children, the Honorable Order of Kentucky Colonels, and those are the kinds of things that we'll continue to do in the future. We'll get more individuals investing, we'll continue to go after grants, and certainly talk to local businesses about investing to make us strong.
So to date, how much has been raised, and as we wrap up our conversation today, tell us a little bit about how we can learn a little bit more about how we can invest and contribute.
Sure. So in their first year, this foundation board has raised over $450,000 for the Nicu and in excess of $500,000 in total. So very, very significant amount of money for the system in year one. You can get involved. You can keep it in touch on our website, rhmh.org. We have a lot of information and messaging on social media, and we'll also be doing a newsletter, the Hardin Memorial website. We'll be happy to come and speak to organizations around town, and we're happy to sit down one-on-one and talk about the needs of the system and how people, it's an amazing cause, and we're really optimistic that a number of people from around the region are going to want to support us. And Hardin Memorial Health is the largest single charity by far in the 10 county regions. A couple of years ago in 2014, we had almost $16 million of charity care that we provided. So we take care of people no matter their situation. And so it's a great place for people who want to invest and who want to make a difference to plug in.
So people can definitely keep up with what's going on with Hardin Memorial Health and definitely with the foundation by going to our website, liking us on Facebook. I know there's an awful lot of social media out there with what's happening with events, current things that might be happening with the foundation as far as like the neonatal intensive care unit, next steps. And so as we do that, I'd really like to thank all of you for being here today. Our viewers, please take an opportunity to go to our website to learn more about how you can contribute to the Hardin Memorial Health Foundation and learn about actually what's taking place by going to rhmh.org. We hope you tune in next month, and thank you again for being here with us, all of you, for another important edition of Health in the Heartland.